I am Dr. Thomas Joseph, consultant physician and diabetologist, Carmel Medical Center, Palam. Today I am going to speak about diabetes and metformin. The metformin is the cheapest and the commonest drug used for treatment of diabetes. That is mainly type 2 diabetes. It's a wonderful drug. Its purpose, the main action is increase the peripheral utilization of glucose. That is, the patient pancreas is not secreting adequate insulin by the beta cells. So the glucose level in the blood of diabetic patients increases. That causes glucotoxicity. Also, most of the patients may be insulin resistance. So we have to choose a drug that will decrease the level of glucose in the blood. Mainly the metformin converts the glucose to glycogen, and the starting dose of metformin is 500 mg morning and evening. That is 500 mg BD. That is the time of administration of the drug. You can take the drug immediately after the food. Usually previously we are saying that before you take the drug before the breakfast or before the dinner. There is no need for that. You take the breakfast and also the drug at the same day in the table. After finishing the breakfast, immediately you can take the drug with 1 glass of water. Only side effect is some gastric intolerance. It causes some gastric dyspepsia, some bloating, some acidity in some patients. In that patients only we can change to other drugs, that is insulin secretagogues. That is climiprid, glipizide, glycoside, like that. But in worldwide, as we look into the treatment of type 2 diabetes, the most common drug and the first line, that is the International Diabetic Federation, as per the International IDF, International Diabetic Federation guidelines, the first line drug for treatment of type 2 diabetes is metformin. The only contraindication is renal failures, all failures, that is renal failure, cardiac failure, hepatic failure. In any failure, you have to stop the metformin and we have to change over to other drugs, because in failure cases, if you are giving metformin, that causes lactic acidosis. That will cause the patient in more maybe difficulty in managing with metformin. So we can change to glimepiride or insulin in acute stages also. The metformin, if creatinine level, it also depends on the creatinine level. That is, if creatinine level up to 1.4, we can give the normal dose. Also, it is based on estimated glomerular filtration rate. That is, if estimated glomerular filtration rate is below 60 ml, we have to reduce the dose to half the dose. If below 30 ml EGFR is present in the patient, we have to stop the drug. No other contraindication. We can give in all patients with type 2 diabetes, we can give this tablet metformin. Dosing is 500 mg BD. We can increase the dose to 1 gram morning and evening. That is, total dose per day is 2 gram. We cannot give 3 gram, 4 gram like that. Only maximum dose we can give to a patient. For type 2 diabetes patient, the metformin dose is 2 gram per day. That is, can be divided in single dose. That is, it can be divided in morning and evening dose. It cannot be given as a single dose. Some patients are taking, sir, I am usually taking the metformin in only morning or evening. That is not the practice. In usual clinical practice, the dose of the metformin is 500 or 1 gram. It should be given in divided doses both morning and evening, because the dose or the duration of action of the drug is 8 to 12 hours. So if you are giving only in morning, the drug will action will stop by evening. So there is no drug to act in the after dinner. So the fasting blood glucose will be high. So to control the fasting blood glucose, that is should be within, that is 100 to 120 or 130, we have to take evening dose of metformin. So metformin is a wonderful drug. It will reduce the weight. It can be given in obese, overweight patients with type 2 diabetes. It is not a drug for the treatment of diabetes mellitus. It can be given in polycystic ovarian disease, that is for overweight patient to decrease the body weight. In so many conditions it is given. So it is the most commonest and cheapest drug we can use for the treatment of type 2 diabetes. Only contraindication is failures and elevated creatinine or elevated reduced GFR patients. In all other patients, if it is tolerating, we can have a good control. The most common advantage, it never causes hypoglycemia. It never bring the blood glucose level below 100 or 80. So it is the safest drug. We can give in all patients, in elderly patients. It is a better drug and used in a first line drug in the treatment of diabetes. If you have any queries or any doubts, or you can post in the chat box, or you can comment about the video. Thank you for listening. We can see in the next video. Thank you.